knows who I am pretty much. I welcome guests, but I want to introduce Tanya Grizzle to you. Tanya has a clinic in Duluth, Vitality, and she has been working with regenerative medicine for 8 years and the clinic for 13?
Yep.
Yes, so she's very knowledgeable. I'm learning from her. Since this is new to us and a new, just a new process for us, I thought it would be good to call on people that have wonderful experience in the area, have seen the great results. They also, there's a regenerative medicine group that I have joined, and they also call on Tanya to do training for them. So we're very happy to have her. This is Tanya Grizzle, and I'm going to let her basically present. She has a wonderful presentation, and will answer questions and handle all of this. And I'm going to listen and learn as well.
So maybe this will be nice and refreshing, right? You're going to learn a lot. I'm going to start with a video I'd like to show everybody, and it's just a very simple video, but it kind of gives you the idea of what we're going to talk about. And then we're going to take that video apart, okay? And you're going to learn a lot about regenerative medicine. Has anybody heard about stem cells or read a bunch of stuff about stem cells lately? Okay. Yeah, it's a very popular topic right now. Yeah. Very, very popular. So I'm going to tell you about the myths of stem cells and about the facts of stem cells. So, and we're just going to tear it down and make it very, very simple so that everybody understands. One thing I will ask, if you guys have questions during, because you will have questions, but I promise you, most likely by the end of the presentation, most of those questions will already be answered. And you'll go, oh, okay, I should have asked that, right? So just keep your hands down, write those questions down on the back of one of your papers in the folder there, and then I'll ask for questions after, because I even do a very simple Q&A at the end on the video. And it's pretty much the same questions. I know every once in a while I get thrown I get into a predicament with a question. I'm like, I don't really know. But for the most part, everybody has the same questions. So wait till the end, write them down so that you remember them, and then we'll answer all those questions at the end. So we'll start with this video.
If you're watching this video, you're probably among millions of people who needlessly suffer from knee pain, elbow pain, foot pain, shoulder pain, peripheral neuropathy, joint pain from arthritis, and many other conditions. Unfortunately, those who suffer from these problems have had virtually no options to relieve or fix these issues. Many people try over-the-counter pain relievers and expensive prescription medicines that do not fix the problem and may only offer some temporary relief with sometimes devastating side effects. Some people are recommended surgeries that are risky, expensive, painful, and may or may not fix the issue. Even worse, some are told by their doctors there is nothing that can be done and are left to suffer every day without any good options. The good news is, there is a growing field in healthcare called regenerative medicine. Regenerative medicine has already been responsible for helping hundreds of thousands of patients with these types of conditions while preventing countless numbers of surgeries. Regenerative medicine is the rapidly advancing area of medicine that has the ability in many cases to help repair injured and damaged tissue in the body that was not possible before. The types of regenerative medicine used in this office are regenerative tissue such as umbilical cord tissue, umbilical cord blood, amniotic fluid, and amniotic membrane. These types of regenerative tissues are a next-generation, non-surgical, minimally invasive treatment that uses the human body's own ability to heal, repair, and regrow tissue. Regenerative medicine brings hope and possibilities that were not available before. That's right, finally, there is hope to actually fix your problem. We do this by using the healing and growth components along with mesenchymal stem cells that helped you develop and heal from when you were born until fully matured. These same components that helped you develop, grow, and heal are found in the regenerative tissues we use. Mesenchymal stem cells are your body's master cells. The reason why they are sometimes called master cells is because mesenchymal stem cells are multipotent. What multipotent means is that these types of stem cells can develop into more than one cell type. So if you have a joint problem, they can become joint cells and fix your joint. If you have a tendon problem, they can become tendon cells and fix your tendon, as well as cartilage, muscle, ligament, or other types of cells needed to fix your area of pain or injury. One of the reasons your body may not be repairing itself is, as we age, the number of mesenchymal stem cells in our body decreases. When we are born, we have around one of these mesenchymal stem cells for every 10,000 cells. As we get older, the percentage of mesenchymal stem cells to other cells decreases. As percentages decrease, it gets harder and harder for your body to repair itself. It is harder because mesenchymal stem cells are what help our body repair injuries. If we have less mesenchymal stem cells, then we have less healing potential. This may be why your body does not heal or respond to treatments the way it did when you were younger. When you get to be age 50, your ratio could be as low as 400,000 cells to every one mesenchymal stem cell. That is a 40-to-1 decrease, meaning your body has 40 times less healing potential as it did when you were born. At age 80, it could be 2 million cells to every one mesenchymal stem cell. That means 200 times less healing potential than when you were born. The procedure is simple. Our medical professional will inject the regenerative tissues right into your area of pain or injury. The mesenchymal stem cells, as well as the other healing and growth factors injected, are as powerful and concentrated as they were when you were a child. This helps give you back the healing and repair power of your youth. Stop suffering. Be able to do things you have not done in years. Live again with little or no pain. There's now a better option. Thank you for watching this video. If you or someone you know are tired of dealing with pain or other problems that these regenerative tissues may help and would like to find a solution, we are happy to offer you a free consultation to see if it might be right for you.
We have many, many different types of cells. But these stem cells that we're talking about, they're called mesenchymal stem cells. Some people pronounce them Ezekiel stem cells. Mesenchymal stem cells, the study of mesenchymal stem cells has been around forever. Think about it. We were all made from mesenchymal stem cells. So they've been studying the cells since the early 1900s. They've been actually using these cells since the 1940s. So this is not new. It's actually getting very public now because there's so much research going on about it, and we're actually able to use them in the United States now, not just for research. Okay, we can actually use them on patients. So that's what we're going to be talking about today, and we're going to break it down very simple. So we are with Dr. Lucienne Moyer in her new practice. The reason she got into this practice is because she is a member of a group of chiropractors and MDs and nurse practitioners and all sorts of different people that I belong to myself. And we actually go around, and a lot of our job is to educate the public on what's out there. Well, we do a lot of regenerative medicine. In our clinic, we do a lot of regenerative medicine. We work with the University of South Florida through this group. We work with New Life Laboratories. We also have a lab we even work with down in South America. So there is a lot going on, and there's a reason for all these different organizations, and we'll cover all of that today. And then normally my clicker works, so it's a little bit easier, so I'm going to have to keep turning around because ever since COVID, I've not done this talk since January, and I used to do it 3 times a week, so my clicker always worked. For some reason today, of course, it doesn't. So we're going to be talking about regenerative medicine. So if you're here, there's obviously a reason, right? You either have pain. Does anybody in this room have pain somewhere? Okay. How many knee issues do we have in here? Knees. How about shoulders? Shoulders, torn rotator cuffs, tendonitis. Okay, so a lot of things. I'm sure the majority of people sitting in this room have back issues, right? Backs and hips and all these degenerative type issues that we face that honestly, up until recently, there's never been anything for except for take your cortisone shots, do your opiates, and chiropractic for sure. Well, chiropractic is wonderful because it actually relieves pain and kind of gets things back in a line. But this is why Dr. Lucy wants to incorporate this in her practice. Even though she can make you feel better and a lot of times become pain-free, we can't grow cartilage in those knees through chiropractic. So I love her passion of wanting to put something else in here that brings it a step further. Everybody's always going to need chiropractic. Sorry, you are. All right? But we can take it one step further. So now, instead of masking the problems, right, with your typical MD, those who do not know regenerative medicine, now we can actually fix those problems. Okay? And nobody wants to just sit there on drugs and mask a problem, right? We want to fix. So we're going to share with you all about regenerative medicine. Now, this young man is Dr. Grimsley. We call him Dr. G. Dr. G and I have been around each other for a long time. One of the sweetest men you will ever meet, funny as can be, down to earth, and he's been doing regenerative medicine since 1985. So, not so young. He's fun. He will be joining Dr. Moyer in her practice to be doing the regenerative medicine side. Also, Miss Leah here is going to be working with Dr. Moyer, and she's going to be learning a lot. She and I will be working a lot together to get the whole regenerative side running really smooth in this practice, since she will be doing regenerative medicine now. It will be outside of chiropractor, of course. She's still going to have her chiropractor, but she's adding a whole other side to her medicine. So Dr. Grimsley will be involved with that. Now, Dr. Grimsley graduated from University of Alabama, Tennessee first, then University of Alabama Medicine. And he's been around, like I said, regenerative medicine since 1985. He started in erectile dysfunction. And I know that sounds weird. You're like, what? How's regenerative medicine playing into erectile dysfunction? Well, it certainly does. We use people's platelets every day to fix erectile dysfunction. We do. We can fix things now so simply by using what's in your body, and not have to go with all the pills and the shots and everything else. So that's where he started. And ED definitely is a part of regenerative medicine, and he's gone from there. I told Dr. Moyer, she's very lucky to get him. He and I work beautifully together. I know she will work beautifully together as well as with Leah. But he knows a lot about it. He has been to almost as much training as I have when it comes to stem cells. He's very good at the injections, and he makes it very easy. And then we have Dr. Moyer, who, like I said, she's done chiropractic care for over 30 years, but she wants to take it a step further and actually go into the progression of regenerative medicine. Okay, rather than she's going to continue to make people feel good and get people's spine in line and help with joint pains and stuff, but we're going to take it a step further than that. So we work with a group, as Dr. Moyer said, that's full of medical professionals, and we work together and we meet about, for most people about 6 times a year. For me, a lot, too much. But it's a great group of people, and we get to actually do clinicals as well as seminars with these doctors. I help this group out by training some of the docs and some of the nurses that come to these trainings. But we work with a great group of people, and they're all medical professionals. So we have Dr. McLennan, who's an orthopedic surgeon, Dr. Johannesson, who's an orthopedic surgeon, and we have Dr. Spencer down here, who's a neurosurgeon, Dr. Karadimas, who's an orthopedic surgeon. These are the people that we take our protocols from, and we also do clinicals with. Dr. Greenlaw, who's a plastic surgeon, and I saw some of you guys flipping through your page, and you saw on page 13 the girl with no hair, right? Anybody flipped through there and you saw that? Turn to page 13. So we have Dr. Greco, who does hair restoration. And again, we're like stumped. What's hair restoration have to do with regenerative medicine and stem cells, right? Well, this is Dr. Greco and Vicki Mansavage. She is the CEO of New Life Laboratories, where we get all of our cells from. They heard about this little girl from California. She was in high school, and they decided that they were going to, well, one thing, she dropped out of high school, she became very, very depressed and suicidal and didn't want to continue on. You got to think about, if you look at her pictures, going to school like this with half your hair gone is devastating for a young lady or any man, especially in high school where there's so much pressure. They flew her down to New Life Laboratories, and Dr. Greco treated her. You will see right there her final treatment after, back in high school, perfectly fine. That was done with stem cells. So that is why they've kept Dr. Greco on as a PhD in hair restoration. We do a lot of stuff with hair growth. So just know, yes, stem cells are great for degeneration of joints. It's great for soft tissue tears, but it's also used aesthetically. Because there's nothing worse that brings people down in their confidence than something aesthetically that they don't like about themselves. And that would be one. So that's very important. Dr. Halpern, who's a podiatric surgeon, because we do a lot with neuropathy. Anybody in here have neuropathy? Nobody? Okay, I was going to say this is the first group I've ever spoken in front of that didn't have neuropathy. Diabetes? Yes. Diabetes? Okay. So this is the reason Dr. Halpern's on board, and then Dr. Kevin Wilkes, who's a doctor of physical therapy. All very, very important people to us. We work with these guys, and there's some other ones too that we work with down in clinics, but these are the main guys. So this is not something that we take lightly. We have some of the top experts involved in this field, and very credible people. So I always ask this question, and this is open to the floor. You can raise your hand on this one. What does pain cost you? And I don't mean money. Hobbies?
Enjoyment.
What? Driving, you said? Somebody said driving?
Enjoyment.
Oh, enjoyment, absolutely.
Exercise.
Maybe you've had to get rides with family members because you weren't able to get around yourself. So quality of life is everything, right? Because it's not necessarily about money. You can have all the money in the world, but can't enjoy your life. So it's about quality of life, being mobile, right? Enjoying to do the things that you want to do. So we're going to introduce you to this new field of medicine. It's not a new field. It's been around forever. They just call it regenerative medicine now, okay? And so what does regenerative mean? Regenerative means to bring back into existence. So something that kind of went away or degenerated, we're going to regenerate it and bring it back into existence. It's kind of like when a chameleon loses its tail. What happens? It grows back. Yeah. So same thing. So whether, say you have a bad knee, I'm going to talk a lot about knees today because I promise you 90% of all people we see is knees. Knees is the number one thing that we treat in our office. Knees, we can actually regenerate the cartilage. So if you've become, say, a knee degeneration is in 4 different stages, right? 1 being your knee's okay, you've got good enough joint space there. 4 being you really have no joint space. If you have something for us to work with, we can regenerate the cartilage in the joint capsule without having surgery. You don't have to have a knee replacement. We're going to talk about that stuff too. So bring back into existence, and we're going to tell you how we do this. So we're not talking simply about just giving you a pill to take and say, go on home and rest and, do the heating pad and put some cold on it and you'll be fine. And by the way, take this opioid. That's really going to help you, right? A little lorazepam, calm your nerves down. It's all good. That's not going to do you any good. We're really talking about rebuilding, repairing, and healing. Healing, a final destination. Healing, get you nowhere near a surgery room. So we're not discussing simply how to feel better, but how to actually repair an injured area. So the goal is to stop degeneration and reverse it, okay? If you just stop it, you're still degenerated, right? You're not gonna, that means you just stop it. It's gonna stay where it's at and your knee's still gonna hurt. We're gonna reverse that process. We're gonna heal those soft tissue tears, such as a meniscus tear, which are pretty common. Anybody ever have a torn meniscus? Okay, very, very common, but without going into surgery. Put that cartilage back, okay, in the knee. Or the elbow tendonitis. Anybody ever have tendonitis? That's a horrible thing. It hurts. It aches all the time. Neuropathy. We see a lot of neuropathy patients, and usually that starts with people who are diabetic, but I've seen people who honestly couldn't even walk. They had neuropathy so bad. And actually that neuropathy usually starts around the ankles and the feet, and it'll spread all the way up to the thighs. I've actually had patients in there that literally couldn't even get in the door. We had to help them in the door. So now, there is, in the past, there's never been a treatment for neuropathy. Well, there is now, because there is no surgery for neuropathy.
Most everybody knows someone that has had cancer, unfortunately.
Yeah.
And after the chemo treatments, neuropathy is very common. We have several.
Yeah, and the thing that I hear all the time is I have children bring their parents in and they're like, oh, they have neuropathy, and they kind of shrug it off as it doesn't really hurt. Well, no, it does. It does. It's constant pain. So in order to regenerate tissue, besides these stem cells, we're going to get into stem cells, you need a lot of different things. Now here's the thing. One thing that actually sets the framework for actually regrowing tissue, cartilage, or mending soft tissue tears comes from your own body, and everybody has it. It's called PRP, or plasma-rich platelets. Every single person in here is fine. Is fine. I can get that from you right now. Stick a needle in your arm, draw it, spin it down in a certain tube, and here you go. That beautiful gold stuff that comes up to the top, that's where your platelets are, and they're very concentrated. Within those platelets, you have HAs, cytokines, proteins, fibrinogens. These are all the things that actually lay the framework. So it's kind of like if you built a house and you're building a ranch with a basement. What are you going to build first? The top floor or the basement? The basement, right? Because if not, the top floor is going to collapse. Okay, so that basement are everything that's in your PRP. And you don't need any help getting that from your body. All right, everybody has it, and you're good. The thing that we don't have is going to be the cells, and that's the mesenchymal stem cells. And you saw in the video, as we age, you lose the amount of mesenchymal stem cells. And we're going to talk about that. You'll be able to see by your age on a chart I'm going to show you as to about how many mesenchymal stem cells that you actually still have in your body. But you need these cells. So what are mesenchymal stem cells? What are they? What do they do? Well, first of all, when you have a woman who's pregnant and she's producing a baby, right? A baby is being grown, a fetus is being grown. Without mesenchymal stem cells, that child cannot form. Mesenchymal stem cells is what made every organ in that child's body made their eyes or ears or toes or mouth. Everything about you was from a master cell. Now, we all have fat cells. Is a fat cell a mesenchymal stem cell? No. Is a nerve cell a mesenchymal stem cell? No. There's many different types of cells, but guess what? Those MSCs, as I call them, they can become a nerve cell. They can become a tissue cell. They can become anything. They are young. They are undifferentiated. It just made a fetus. It can become anything. Now you kind of see where we're going with this. So stem cells line the blood vessels at birth, and they help repair broken bones, heal burns, cuts, coordinate the growing of our bodies. Now think about this. How many people have grandchildren in here? Okay, what happens when you're running? The child is running, and they fall and skin their knee. How quickly does that heal? A couple days. What happens when you run, fall, and skin your knee? Month, 2 months, maybe 3. Or sometimes it never heals. You want to know why? Stem cells. That young child, that baby, that 2-year-old, whatever, they are loaded with mesenchymal stem cells. As we get older, you lose all of that. You have 2 surgeons in a room, and you have the same procedure that you're going to do on a 24-year-old and an 80-year-old. Who do you think they want to operate on? The 20-year-old. Why? Because their chance of healing and surviving is so much greater than the 80-year-old. It's why a lot of times you hear and see 80-year-olds that go in the hospital, or 90-year-olds, it's 1 in 2 million is a stem cell. What happens is they get pneumonia in the hospital, a lot of times they don't make it out. Their bodies cannot heal itself. All right, so that is why youthful people tend to heal a lot quicker. It's because of these stem cells. So what normally happens is when you experience pain, you go to the doctor, right? And they first thing they want to do is they take their x-rays and they say, yeah, your knee doesn't look so good. You're going to need a knee replacement sooner than later, okay? And the first thing they do, they're going to give you some hydrocodone or Mortab. They're going to give you some oxycodone or whatever they're going to do. They're most likely going to give you an opiate, right? You're going to go home, you're going to take that, and you're going to feel good, right? You're going to feel good, and you're going to walk around and go, okay, this isn't so bad, I can do this. But opiates are very addictive, number 1. Number 2 is, remember, you're not healing the problem. What you're doing is you're masking the problem, right? And then number 3, that eventually is going to wear off, and you're going to have to keep taking it, so you're going to become addictive. So then what they're going to say is, come on back, and we're going to give you a cortisone shot. Who's ever had a cortisone shot? Not pleasant, right? And the more you have, the less time that they continue to work. The other issues that what no doctor will tell you this. I'm sorry. Well, my doctor will. But no other doctor's going to tell you this. A doctor's not going to tell you, well, come on in, let me give you a cortisone shot, and we are going to destroy that joint space even more. Because that's what it does. It breaks the joint space down. While it will numb the area, and you won't feel pain for a little bit, you are destroying your body worse. And they're not going to tell you that, okay? So what happens, so we start out with the opioids and stuff, and the painkillers, and the problem becomes worse and worse, and the fact that you get addicted. And we all know that in the United States, the opioid crisis, the oxycodones, the fentanyls, the things like this, they actually kill more people every week than car accidents do. So not a good thing to get hooked on, because it's almost impossible to get off of. And it's doing nothing for your issue. Non-steroidal, when painkillers don't work, I'm sorry, I'm going backwards. Non-steroidal injections or anti-inflammatory drugs, such as Advil, Aleve, ibuprofen. Anybody take any of those NSAIDs? Okay, just know, those also break the joint space down. They're not good for you at all, not to mention they're all filtered to the liver. So none of it is good. And you can't live the rest of your life taking, let me wake up and take 2 ibuprofen every morning, and then another 2 at noon, and then at 2, and then at 6, and not good at all. Not good for you at all. They will destroy cartilage over time. Studies have shown when taken for 4 months, cortisone can cause an 8% loss of bone. Now, I do see one young man, but he's the only one I see that's really young in here. The other issue we face with cortisone shots, steroids, all these different drugs is that they actually deplete the bone mass in your bones. Men have to worry about that just like women, but women have to worry about it more. Women use a lot more D3, our bones hollow out quicker, and we lose our density in our bones. Who in here knows a woman who's fallen and broken her hip? I'd say everybody in here. Okay, women will use that D3 quicker and it does not stay within their bodies. And the other problem is, and everybody in here should write this down, you should go home and order it right away. Go to Amazon. But there's something called D3, which makes healthy bones. A lot of people think if you eat D3. D. Okay, and everybody knows that is vitamin D, right?
Yeah.
But here's the issue. One, your bodies can't even metabolize D3 properly or effectively, okay, without something called K, like potassium, 2. So if your D3 does not have K2 in it, you kind of defeat the purpose. And I see it every day in labs, every single day. I have women who come in and they say, but I take, 100 IUs of D3 a day. Then why is your D3 17 when it needs to be 90? It's really important, and it's equally as important for men, even though it does affect women worse than men. So it's very, very important. So go to Amazon, go to your health food store, get some D3 with K2, and you're going to want to take 90, no, is it 90? Yeah, 90 IUs or 10,000?
10,000 IUs.
10,000 IUs. It's been too long since I've done this, but anyway, I take it every day. But it's got to have the K2 in it. It really does, in order for your body to absorb it and use it properly. And that's one of the cheapest pieces of advice I can give anybody for healthy bones. So we all know when you get a cortisone shot, the doctor will tell you can only have a few of these a year, max usually is 3. It's because they're very, very harmful for you. So when drugs fail, the next alternative is they're going to say, well, you need surgery, right? So what happens in the United States, in our healthcare system, can you see?
Yeah.
Okay, good, I'm sorry. What happens is you call Dr. Brown, and you go in to see Dr. Brown, right? And Dr. Brown says, or Dr. Jones in this case, says, you know what, let's put you on that opiate, that's fine. So, okay, good. But then you realize, like, 2 weeks go by and you go, oh God, I'm so constipated. I don't know what to do. So you call Dr. Jones back and you say, hey, Dr. Jones, my knee's feeling great. I got issues. I'm constipated. Oh, don't worry. I'll have my nurse call you in something, right? Nurse calls you in something, which is great. And you're not constipated anymore. Your knee feels great. Then you got an upset stomach from taking all this stuff. You call Dr. Jones back and say, Dr. Jones, great. I don't feel my knee. I'm not constipated anymore, but my stomach is just torn up all the time. Well, let me have my nurse call you something in. This is not a lie. I had one patient come in with an 8.5 by 11 piece of paper with 27 medications on. They were taking from Dr. Jones because, and I asked him, I'm like, do you know what you're taking? Why are you taking all this? And, I don't know, doctor told me to. That's not a good answer. If you don't know what you're taking, you probably shouldn't be taking it, okay? But just know, you don't have to take there's no reason to take tons and tons of medicine because you get stuck in this cycle of let me call in something else, and that's usually what happens. When none of this works and you get sick and tired of that 8.5 by 11 piece of paper that you got to bring to your doctor's office every time you go, which I get all the time, then the doctor's will say, well, you know what? I think you need surgery. That knee replacement, that torn rotor cuff surgery, whatever it is, I think you need surgery. But what they're not going to tell you is 10 years later, guess what? You need another surgery. You're going to go through all that pain, all that money on the physical therapy, time off, all the prescriptions, all the over-the-counters, while you're destroying it even more, taking all this after your knee replacement. Sometimes I wonder if that's a conspiracy. They give you all that to destroy it again so they can get you back in, right? So, but you will need another surgery, okay? And that's just kind of how our health system is. So today we're going to talk about a solution to all that. So we're going to be talking about stem cells. Stem cells is a science now that everybody is studying and really going far with. All right, there is Mayo Clinic, Cambridge, Oxford, Stanford, Emory University, right here in our backyard, are doing clinicals with stem cells. So everybody's studying. It's just not Dr. Moyer or Dr. Grimsley or whatever. I'm talking about major healthcare systems are using stem cells, and now it's available to the public. So when you were young, when you were a baby, 1 out of every 10,000 cells was a stem cell, and they multiply every 24 hours, which is great. That's what we want, right? By the time, who thinks 20 is old? How old are you?
16.
Oh,
Just a baby.
I know, you are a baby. That's awesome. Boy. Anyway, by the time you're 20, who thinks 20 is young in here? I know I do. Well, get this. By the time you're 20 years old is basically the age you stop growing. The age you stop growing, 80%, look at that number, of your stem cells have become dormant or they have died off, and that is when degeneration starts at age 20. So pretty crazy, right? It's not 30, it's not 40, it's not 50, it's 20. 20 years old is when the stem cells are completely going dormant and starting to die off. The older you get, so by the time you're 50, it's 1 in 400,000, and by the time you're 80, it's 1 in 2 million. Now you see why an 80-year-old going in the hospitals, body cannot heal itself. Now if you look at this chart, you can kind of figure out where you're at. Infant, 1 out of 10,000. Teen, 1 out of 100,000, so you're still okay. 30, 1 out of every 250. 50, 1 out of 400, and 81 out of 2 million. Here's what I always tell people. I'm 58, so my number is, it's getting up there, right somewhere in here, about 1 out of every 650, 700,000, right? But the issue with that is, not only do I lack stem cells, but I can promise you, most of mine are on crutches, the rest of it that I have. You know, we've damaged our bodies, so you can figure out where your number is, and you can understand why you don't heal the way you used to when you were a child. So what is a stem cell? We've talked a little bit about it. It is a single cell that can multiply and differentiate into any other cell type. Remember, it made you. It's not set in stone. It's not a nerve cell. Can it become a nerve cell? Absolutely, it just did. Can it become a fat cell? Absolutely. Can it become whatever, brain cell, any type of cell? It can become anything. It's undifferentiated. That is what a stem cell is. Now, this is a video by the Mayo Clinic. I want you to see, we'll talk about it a little bit. This is really cool. The kind of research that they're actually doing. You'll understand basically what we've just talked about.
You're looking at a few hundred cells here that are working together.
The heart muscle cells that Dr. Tim Nelson views highlight recent advances into regenerative medicine.
The simplest way to explain that is it's the opposite of degeneration.
Tissues in your heart, joints, and other areas can degenerate or break down with time or disease. Regeneration is the renewal of those tissues, which is something the body does naturally.
So one strategy is to try to find ways to improve the healing of your body, and another strategy is to actually supplement or augment the stem cells in your body so that we can improve the healing by transplanting stem cells into it.
Dr. Nelson and his colleague Dr. Andre Terzik use stem cells in their research because stem cells are responsible for growing new tissue.
So stem cells just means that they're seeds that can grow into many, many tissues.
Stem cells can come from a variety of places: embryos, which are not generally used anymore, umbilical cord blood, or adult bone marrow.
So the type of stem cell will dictate how many different types of tissues can emerge out of it.
Scientists can engineer stem cells into the type of cells they want. Here's how it works. Cells called fibroblasts are removed from a patient's skin. They're reprogrammed into what are called pluripotent stem cells. Those cells can be taught to become any type of healthy cells, such as these heart muscle cells. The idea is that the newly engineered healthy cells, when introduced to, say, those of a failing heart, will help restore or regenerate the function of the unhealthy cell.
This is one cell that's contracting, is working with many cells, and that gives the whole tissue the contraction pattern like a normal heart.
It becomes much more real when you have a personal connection to a disease or an illness where we don't currently have good options. And this is where people are asking more and more of the questions, what about stem cells?
The answer is researchers such as these at Mayo Clinic push forward to make regenerative medicine a reality for patients searching for successful treatment and perhaps cures. For Mayo Clinic News Network, I'm Vivian Williams.
So pretty cool, right? Placing heart muscles, repairing the heart muscles with stem cells. So stem cells can do a lot of things. Now, what you saw there in the laboratory is they talk about using someone's skin to get the fibroblasts from the skin. What they're talking about basically is culturing cells. Okay, in the United States, we can culture cells, but not to be used on human beings. Okay, we can actually, they can be taken from the wort jelly, which we're going to talk about, and used on you guys, me, whatever, in the United States. They're culturing for research, all right? So it's a little bit different, but same idea, where they're actually doing enough research to be able to do things like that. So where do we get our stem cells from? Where does Dr. Moyer get her stem cells from? Well, I can tell you where she's not going to get them from, and that's going to be, she's not going to be using embryonic stem cells. Number one, they are illegal in the United States. They're surrounded in controversy, and they're just, it's not allowed. So, you know, there's a lot of talk about, oh, they use dead babies to get the stem cells. No. It's not going to happen, okay? No embryos. Some people, and you'll understand this, some people, bone marrow. Some people will use bone marrow. There are clinics out there that will use bone marrow, but let me ask you this. You just saw my chart of, by age, how many cells you have, right? Do I really want to use, do I want to go through a painful method of getting my stem cells from the bone marrow, getting bone marrow aspirate, which is very, very painful? Do I want to do that when, like I said, my number's 1 out of 700, whatever, thousand, and most of them are damaged? Doesn't make sense, does it? It doesn't. Why do I want my own cells? Because we already saw where my cells were. I may want his cells, but no. You can't swap cells either. Not even if you're in the same family. Unless it's for DNA, something like cancer, that's totally different. But for this, no, you gotta use your own. So no, you don't want for that reason. Some doctors' offices, they'll use adipose tissue, which is just fat tissue. They'll go in, they'll use a little cannula, and they'll do it, and they'll spin it in a centrifuge. But again, if I'm 58 years old, do I want to try to find a needle in a haystack? Doesn't make sense at all. So why go through all that? You don't need to. I do know why offices do go through that. You know, they'll add some amniotic fluids and exosomes with it. They're still going to add tissue transplants with that. But it's also a very cheap way to do things, but it's not as effective. So I don't, you know, in our clinic, we go for optimization on everything. I don't want to be in the middle of the pack. I want to be way over there. I want to be the leader. Okay? I don't want to be in the middle. Because there are some things that are just okay and some things are not okay, just okay. Okay? So we want to be optimized on everything we do. So where do we get our stem cells? We get them from the Morton's jelly, the umbilical cord matrix. Okay, so mom, child. Child is being made, right, through the umbilical cord. All those beautiful MSCs are passing through there and they're making that child, right? At the time of birth, and it can only be cesarean birth, live cesarean birth from a mother, the mother is asked, do you want to donate the umbilical cord? You'll hear that every woman. If you guys have children, having children, trust me, they're going to ask you, do you want to save the umbilical cord? There's a few things they don't tell you, and I'll tell you about those too, just in case you have a child, get ready to have a child. But that umbilical cord, and especially closest to the fetus, has millions and billions of MSCs that are still multiplying rapidly. They've just made a child. That's where we get it. So what they do is they take the umbilical cord. There's 2 arteries within that umbilical cord. They strip those arteries out, and what's left is the Wharton's jelly. So it's like, literally like jelly. All right, and that's what they're using. That's where all the MSCs are, and that's what you're getting when you come in for knees or shoulders or whatever. That's what we're injecting along with, remember what everybody else has? PRP. Your own PRP with the Wharton's jelly where tons of stem cells are. Now they grind it up and it comes in a little vial this big and there's 3 million stem cells in there and that's plenty to fix a knee, I can promise you, or a shoulder, or a meniscus tear, or tendonitis, okay? That is what you're getting. It's derived from healthy human after birth. They still have the great ability to replicate. They are mesenchymal stem cells and it is approved by the FDA. The lab we use is called New Life Laboratories. The cool thing about New Life Laboratories is Vicki Van Savage did Life Flight. Anybody ever heard of Life Flight? You know, you get critically injured in a car wreck, or the helicopter's come to get in and flight you out of there. She was the creator of that company. She's been around medicine for a long time. That was 33, 34 years ago. She started that company, and since then she's also worked with stem cells. She's the CEO of New Life Laboratories. What I do love about them is everything, single cell that comes to us has a serial number on it and it is tracked with who you are. So it follows you. So if you get injected with a stem cell at our office, because we use New Life, I know exactly where that came from. I know it's been cleared. It goes through a double sterility process. I'll talk about the different things that the women go through, but these women are actually, they sign up for the program. They make sure that male and female both have good blood work, right? No HIPs, no HIVs, no whatever. They're tested throughout. And it has to be from live cesarean birth because that reduces infection. All right, and then even after, it goes through another testing and another sterility process. So what you're getting is a really, really good concentrated product, and that's what we use. This just talks about the strength. If you see right here, bone marrow aspirate, it's 1 to 317,000 cells per milliliter, whereas umbilical cord tissue, which is what we use, is 10 to 4,700,000 per centimeter. That's some strong stuff, some very concentrated stuff. So these rebuilders, they are called tissue transplants. That sounds kind of crazy, but it is a tissue transplant. They can be transplanted in people wherever they have their issues, whether it be a knee or a shoulder or an elbow, or we do fingers for arthritis. We do all kinds of things. So these are very simple procedures to do in office. And Dr. Grimsley is very good at them. So what can Wharton's jelly actually treat? Okay, so meniscus repairs, ligament repairs, any soft tissue, cartilage repairs, tendinopathy, tendinitis, rotor cuff repairs, knees, hips, spines, shoulders, elbows. Are you going to do spines and hips? Okay, I didn't think so. Spines and hips are a little different. We can talk about that after you may have spine and hip issues, because those are such, the deal with spines, most people don't have one disc that's bothering them. They usually have several different issues, whether it be a herniated disc or a bulging disc, and then several degenerated discs in their spine. So, you know, you put 3 million in say, L5 and so many in your C whatever, and so many in your T whatever, you know, all that's a lot of discs, okay? You'd be broke. Dr. Moyer went on your home. It's hard. It's a whole different, but there is a solution for that too that I'm going to give you. And the same thing with hips. It takes a lot more. Think about it. It's a very large joint. All right. But I will tell you this, because some people have knees. 3 million stem cells in a knee with some PRP is beautiful. Works wonderful. All right. In an elbow for tendinitis, in neuropathy, it works great. So this is a hip that we did. This was when they came in. You can see there is absolutely no joint space there. So this hip should look like this, which it eventually did, but this is completely closed off, and this is a person facing a hip surgery, and it's very painful. Can't even walk. This is after 16 weeks. You can see this beautiful joint space through here that we've created, and that was done with stem cells and PRP. That is one injection. It's not multiple injections. It was pretty easy to do.
Tanya, can you please tell them again, I think some of them were wondering, the PRP is platelet-rich plasma. One more time.
The way we get your platelets, all we're interested in is those platelets. Because within every person's body here, when I draw your blood, and it is a specific tube, and it's spun down at a certain RPM for so long, your platelets rise to the top. The blood goes to the bottom. So you'll have the red blood on the bottom, and you'll have the beautiful gold platelets on top. Okay? I don't want the blood. I just want the platelets. That is where your HAs, your cytokines, your fibrinogens, your growth factors, all of these things that you need to heal your body. It's kind of like a fertilizer, is the way I look at it. We mix that, we put that in at the same time as your stem cells, about 5 cc's of PRP, and then what's that, 1 cc, 2 cc's of stem cells, which is 3 million. Those go together. All right? So your body contains part of it. And then the other, because we're all old in here, we have to get from the Wharton's jelly. Does that make sense? All right, so this is cartilage showing you a 75% increase in cartilage after 5 months here. This next one I love because there's a couple things on this. This is a knee, all right? So this knee, you can see in their initial x-ray here, there's a couple things. They're completely closed off here and pretty much here. Now here's what I always say, if you have nothing to work with, I can't help you. But in this case, I can get in there. We can get in there, all right? You've got something, you've got a little bit left, all right? So we can work with that. If that was completely closed off and you can't get in there, then you kind of waited too late, all right? And you're gonna have to have surgery. Now, here's another question. If you had a knee replacement, can you use stem cells before your next surgery, before your next knee replacement? The answer is no, because you're all mechanical now. You've basically had an amputation of the knee. They've taken everything out, they've replaced it, so once it's been replaced, there's no going to this, okay, just to be clear. You can also see a couple other things right here. It's a bone spur. These are very painful, all right? And you can see after stem cells, no bone spur. Every time I've ever seen a bone spur, after about 12 to 16 weeks, bone spurs are gone. They are gone. Stem cells just attack that and get rid of it. And you can see this is 16 weeks, and they have a perfect knee right there with a perfect joint space. That's what you want your knee to look like.
That's a new knee.
Yes, that is a new knee right there. So really, really important. This next one, I'm not even going to talk about this. This is bracing because it's up to the doctor's preference on each individual case. Sometimes we'll put people in a brace. It really depends on what your x-ray shows. It's just to relieve that pressure. Sometimes we won't. So that's kind of up to the doc. When we talk about knee replacements, I thought, and I couldn't find anything newer on this on the CDC. I looked at the CDC. This was the last thing I found, but in 2008, there was almost 5,000 deaths due to a knee replacement. Blood clots, they died basically from blood clots to the lungs, heart attacks, pneumonia. People all the time that I talk to, they've already had a knee replacement, and they're like, I wish I'd never done that. But then I have other people who say, yeah, mine's been okay. You know, so it just depends. Me personally, I don't want to go through a knee replacement. I feel like I'm too old, and I don't want to deal with all that. It's not when I have an easy solution. So these are some of our patients. These are a while back. I want you to see one, but this is what I want you to notice about this. When they come in, everybody's pretty much 8, 9s, and 10s. Okay, these were our knee patients. 8, 9s, and 10s. You see what happens as the weeks go. Now, just because you get PRP and you get stem cells in your knee today, tomorrow does not mean that you're going to be feeling great. Most likely you're going to be feeling a lot better because of, not because of the stem cells, but because of your own platelets we put in there. You definitely, it decreases inflammation, it just feels really good. And you're like, whoa, this is awesome. While that is happening, that knee is repairing itself, whether it be a cartilage or a tendon or a tear or whatever. It's repairing itself. What I want you to notice is this number right here, this 12 and 16 week column. Usually by week 12, most people are pretty darn good. But I always say the sweet spot is 16. 16 weeks. If this does not happen overnight, remember, you're regrowing cartilage or repairing a tear. So you can see by 16 weeks, almost everybody is completely out of pain, but there's still a few left that are, they may take 20 weeks. I can't control what your body does because everybody's body is a little bit different. All right, but usually 16 weeks is what I see is kind of that sweet spot. And you know, we have you come back in and then we take pictures like I just showed you. So knee replacements are very expensive. Without surgery, about $57,000 in 3 to 6 months of rehabilitation. This is why I always talk about don't have a knee replacement. And even with good insurance, it'll cost you $15,000 out of pocket, physical therapy, co-payments, you name it. So you basically have two choices: surgery, stay on opiates, or you can do something that's regenerative for the area. Now this is a video. This was it's been so long. This is Nancy. We did her back. Yeah, I'm gonna turn it up. It's just her testimony, which I think is neat. And I want you to really pay attention because I'm going to ask you a question after this about her because you'll see what she says and I'll tell you why she says it.
Hi, just wanted to let you know that I've been having lower back problems for over 20 years. I was unable to pretty much ride in the car to the grocery store, get myself dressed, get up and down out of a chair. Anyway, I've been to doctors, I've been to chiropractors, I've been to physical therapy, been on plenty of pain pills, and it all just comes back to being sore, being hurt, having tons of lower back problems. And I did some research on some stem cells, decided, hey, I'm going to give it a try. Went in for the stem cells, was able to go on vacation 2 weeks after I had the stem cells with my family, 5.5-hour flight to Hawaii. My daughter turned over to me and says, Mom, how are you doing? How's your back? I looked at her like, wow, I never thought twice. Would I do stem cells again? I would do them in a second. Nobody could put a price tag on that kind of recovery. I have my life back. I have my value of life back. So anyway, thank you.
So, did anybody notice something she said 2 weeks later? That do you think Nancy was healed? No, absolutely not. But guess what? She had PRP, and we gave her amniotic fluid. That attacks inflammation like no other. So she felt great. She felt great while she's healing. But no, she was nowhere near healed. Nowhere near. But she felt good. She thought she was. But she wasn't. We had another gentleman with terrible neuropathy. He was, how old was he? He was 96 or, oh, bless his heart. And he he could barely walk. And he came in, and we did the same for him, put amniotic fluid in his ankle. And he came back the next day. He was so excited because he said, you know, the moment you put those little busybody things in my ankle, it's never been the same. It's been awesome. This gentleman, for the last 20, 30 years, has not been able to sleep with covers over him because it hurt his feet so bad, because it's nerve damage. So that's sad. Neuropathy is a real thing. So, but no, had it worked on him yet? I mean, this was the next day. No. But we gave him amniotic fluid and PRP, because everybody knows when you have something inflamed, inflammation equals pain. If I can get rid of the inflammation, you're going to be loving me, saying, oh my God, I feel so good. But that does not mean you're done. The process is not done the next day or 2 weeks later. So that's kind of what I want to point out with her. Even though we made her feel great, she was not done. Arms, their legs, just their ankle and their foot, some down the back, some down the front. That neuropathy is very tricky. Very tricky. So what do these transplanted tissues, meaning mesenchymal stem cells, help your body with? Well, one, the reduction or elimination of pain. It reduces the inflammation. It minimizes scar tissue, which is a biggie, okay? We know scar tissue builds up, and it builds up, and it builds up, all right? And that can cause you pain in itself. It promotes soft tissue growth, and it generates new bone, as in you saw those bone spurs were gone. Cartilage, muscle, ligament, and nerve growth. Nerve, very important because of people with neuropathy. Regenerative medical procedures can bring your body hundreds, if not thousands, if not millions. And in our case, it's millions. No one gets less than 3 million stem cells in an injection. No one. To help your body heal naturally. This is a torn meniscus. If anybody's had a meniscus, you can see here. This is 12 weeks later, brand new meniscus. Pretty cool. So there's a reason why a lot of athletes, they will use stem cells, one, because they're natural, right? They can't get in trouble for using them. They're 100% natural to your bodies. So Jeff Dempsey was an NFL player. He's had stem cells. This lady's had them. Vinny Testaverde has had them. Vinny Testaverde, can anybody want to guess why Vinny Testaverde had them done? You would think it's for a rotor cuff, right? Nope. But after he retired, he's good friends with Vicky Mansavage. The reason he's good friends is because she fixed him. But after he retired, he went to playing golf, and it was his elbow, tendonitis. So a lot of the athletes have them. Tiger Woods has had them. Gabriel Taylor. I mean, all your athletes, because it's simple and there's no downtime. You literally leave our office with a Band-Aid. That's it. And how long does an injection take? 30 seconds. And does it hurt? Because these are all the questions everybody wants to know, right? Does it hurt? Well, I will tell you this. You don't feel it. You're going to feel pressure. Like, say we're going into a knee or an elbow, something simple like that. You're going to feel pressure because you got to think, we're putting 6 cc's of fluid in there, right? So you're going to feel that pressure, but we freeze it first, okay? So we freeze it, and I'll be honest with you, people hate the freezing more than they hate the injection. It's just how it is. They're like, God, stop. And then, but it literally takes 30 seconds. 30 seconds to get an injection, and you're done. And we put a Band-Aid on it, and you go home. And we keep checking on you. And we don't want to take another x-ray for at least 12 weeks, because we want to see that progress, big progress. So neuropathy, these are our patients again. You can see they start out 8s, 9s, 10s. By week 16, we're about done. And some people will take it even further. Some people it's 20, maybe 24. Everybody's a little different depending upon, a lot of it's the habits that you've formed through life. All right, so neuropathy, we talked about neuropathy. If you know anybody with neuropathy, it's a couple things. One, you have nerve damage. 2, your capillaries begin to close up. So therefore you have tingling. You have no circulation, basically. So you have all this tingling, right? And your foot or your hand, whatever, it feels like a piece of wood, okay? So this is a neuropathy patient right here. This is when they were first diagnosed, all right? This is at 4 weeks, 8 weeks, and that was 24 weeks. So this person now has feeling. Okay, they've got blood flowing through those tiny little capillaries now. Okay, big difference from here to here. I'm going to show you something really gross, so if you don't like squeamish things, then you might want to close your eyes, because the next one's going to be pretty gross. This was a guy that I worked at a clinic up in Washington State for a little bit, and this guy was diabetic, and it's a diabetic ulcer, and we were able to treat him. And so what you're going to see right here is, that I always when I show this, I don't show this to be gross. I show this so that you understand the miracle of stem cells. Because it's hard to believe when I tell you about, coming from the fetus, and you can think that. I'm going to show you, okay? So this right here started out as a diabetic ulcer, okay? There is no doctor in the United States that's not taking that foot off. They're not. That's an amputation waiting to happen right there. That's from a diabetic ulcer. So we treated him. And 24 weeks later, and does everybody see what was already missing here?
A toe.
A toe. All right. You can see he already had problems, right? But we saved his foot. That's what stem cells do, right there. Now I got even a grosser one. This guy, that started out, that's his heel. Started out as a diabetic ulcer. Started out ulcer. Now that's not a foot amputation. That's a knee down amputation. There's no doctor that would touch that without amputating his leg. But we did. We did. 9 weeks later, 45 weeks, we saved his leg. That is what stem cells do. Alright, so now you understand. This is why I'm so passionate about this stuff. Because I get to see stuff like this. And this is cool. Really, really cool. I mean, these are extreme cases, but this is real, and this happens all the time. We see diabetic people all the time. So we're going to go, I have a Q&A here, which, if you think about the question, we're going to answer those too. So number one is, where does the material come from that's injected into my body? It comes from the Wharton's jelly, from a woman who only does live cesarean birth. It has to be a cesarean birth. And of course it's tested, and these are all the different tests that they go through. So they go through, stringent guidelines have to be met. They go through all the social histories of the donors, physical exam, they go through all the HIVs, all the HEPs, and then they continue to test them, and then after the tissue is donated, it goes through it again. Okay, so this is very, very safe stuff. Nothing's released until it's ready to go. So this is where we get our cells from. New Life Laboratories. Okay, so New Life Laboratories is also funded by the Kennedys, as in Robert F. Kennedy, John F. Kennedy, that family. They have put New Life Laboratories in a clinic out in Mexico for research, so they can culture and grow cells and do more and more research to benefit people like you and I. All right, I'm pretty sure the Kennedys don't just fund anybody. Okay, they're not going to just give billions of dollars away to a lab to do research if they're not reputable. It's another reason we use New Life Laboratories. They're very, very reputable. They know what they're doing, and they go through a lot of extra steps that other labs don't. So the next question is, what does it cost, and does insurance cover it? And I'm pretty sure you'll all know the answer to that. Insurance does not cover it, although insurance will cover some PRP, some plasma-rich platelets, injections, especially for neuropathy, but it does not cover it. But still, in comparison, the cost is not huge. We'd have to talk to Dr. Moyer, but I know what we charge about, and it's compared to what you pay going through a knee replacement, it ain't a third of what you're going to pay. So I also get the question when I put this up, they're like, why won't insurance cover it? I'm pretty sure that if insurance covered this, it would put the pharmaceutical companies out of business. You don't need opioids. You don't need fentanyl. You don't need oxycodone. You don't need Percocet. You don't need lorazepam. You don't need all these different things. I'm not sure if it will ever be approved. I don't think they want it to be approved, to be honest with you. Because you got to think, the number one maker of money is insulin. And they love when people are on insulin. And most diabetics will spend between $1,000 and $2,000 a month just buying their insulin. Yeah, but I got something else to tell you guys. I'll tell you everything. This just gets more and more exciting, trust me. We're almost done with this, but then I'll tell you about something else. So, do I need to be tested to be sure my body does not reject the transplanted tissue? And the answer is no, because these tissues are immune privileged, which means your immune system cannot attack them. Anyone can use them. Remember, they're undifferentiated cells, which means they don't know who they are yet. Now, say you had cancer and you were getting stem cells for cancer, or kidney disease, or something like that, right? You're going to need a DNA match. But that, we're not talking about that. We're talking about soft tissue tears and joints. All right. So no, they're immune privileged. Anyone can use these tissues. All right. So I'm going to play this last video, and then I will take questions. So be thinking of your questions. Yeah, and I'm not sure. I'm sure about. Well, I can tell you about Dr. G's. First of all, you come in for a consult. It talks about that. You come in for a consult. We go over cost and stuff. We definitely have to have an X-ray. In some cases, y'all don't have an MRI. I'm pretty sure, right?
No.
I didn't think so. Most people don't. But sometimes we can see almost everything on X-ray, depending upon what it is. Okay. If it's a joint, if it's your knee, I can see that on X-ray. If it's a meniscus, I'm going to need an MRI. Although we have specialized pricing for even people who don't have insurance, where we only pay $270 for an MRI, which is
Wow.
yeah, very, very cheap. Sometimes we do need an MRI because soft tissue is not going to show up on an X-ray. Okay, so if it's a joint, absolutely. But if it's other things involved with the joint, then we may need an MRI. So we have to go down that route sometimes.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
I love that video because I know who I want to be. I want to be this guy over here for sure. But I think it's cool because I look around in our office every day and I see so many people who are hurting so bad and can barely get around. And that's not quality of life. That's not the way you want to be. So does anybody have any questions? No, this cannot be the first time I've ever had questions.
The sterilizing you do, does it take away from the?
No, and we don't do the sterilization. Of course, we are sterile when we do the procedure, but they already actually going through a double sterility process from New Life, the lab.
does that.
Right. Even though when we inject, of course, it's going to be sterile. You know, we are sterile up. We have sterile gloves on, and everything is sterile. So the injections, like I said, very, very easy. If it's I'm sorry for saying knees all the time, but we just always do knees. You sit on the side of the bed, you hang your knee down. We disinfect it with Hibiclens, sometimes betadine, whatever. And then, everybody's gloved up, and then we actually take the stem cells from the vial after they're thawed, and we mix those with your own platelets. So the platelet is the worst, it's not the worst part, it's a blood draw, it's easy, okay? But it takes 8 to 10 minutes to spin down. So you're sitting there for 8 to 10 minutes waiting for your platelets. And then we inject, we put a Band-Aid on it, that's it.
How much
And
do
then,
you take?
blood?
Yeah.
Platelets, well, we take your blood, and it's just a regular vial. It's a 12 ml vial, and it produces about 6 mLs of platelets because the blood goes to the bottom. It's like literally when you go to your doctor's office for labs, it's there. I mean, that's what you're usually getting. You're usually getting more than that. You usually get 2 or 3 vials, but this is one, and it's plenty enough. Yeah.